By the moment we're heading to the UGH campus, you start to realize what the community looks like. You start to realize where your patients are going to be coming from. You start to realize all those factors that are going to contribute to the diseases that your patients are going to present with.
What makes UGHE distinctly different in terms of medical education is a fascinating topic, I think, but it starts with situation. It starts with proximity to the people who will create the greatest learning for our medical students. Our model of medical education starts with the people who our doctors, our medical students will ultimately serve. And so we're situated in a part of the country that was historically underserved, but a part of the country where people live in very tight-knit communities. But the communities are also dispersed. This is a remote and rural part of Rwanda.
Community-based education is a strategy of UGHE to make sure that our students are trained in communities, that they are able to see context-specific issues and develop context-specific interventions.
What we want to do is actually embed our students within the lives of the people they ultimately serve. So they get to know different members of the family, they get to know the connections in the community, they get to know the community health workers and how the community health workers help patients.
Dr. Paul Farmer instilled in us the spirit of not just focusing on the condition, but also going beyond that, taking care of our patient as a whole. When you see a patient with, for instance, cancer or with a certain condition, you don't see the condition in itself, but you see a patient, you see a family, you see her mental health, you see everything that combines the patient, and that helps us to approach the patient in all those aspects and in a holistic approach.
It was a privilege to see Dr. Paul Farmer in action, both in class and out of class. For me, sometimes when the workload and the patient volume gets tough to deal with, I remember his heart and how he had the heart for patients and was serving from a genuine and loving heart.
They are also able to look at some of the inequities in health care delivery and are able to address them right from the foundation of their training. And this is hoped to influence the way they themselves will treat their patients, the way they will approach policy and leadership.
With UGHE in person, we had a lot of field visit. So these were designed in a specific way that, because we have people from different backgrounds. As a medical doctor, my field was just human health. So I focused mainly on human health, but with the UGHE, we've been exposed to a spectrum of health where just for one to be healthy or stay safe, it has to be linked with the environment and the animal that we consume or we live with.
We're very proud that some of the people that we select to come and work with us, to learn with us, are people who have operated at fairly high levels in their own settings, within teams, delivering healthcare, but also people who are responsible for crafting health policy. In a session with the Ministry of Health and WHO, looking at how we conquered Marburg, how we moved through a devastating outbreak to a place where we can actually begin to reflect on what we did right, and the continent can now learn from what we did and how we faced up to that. And noting that there were several alumni and several people who facilitate learning in the audience, people from the ministry. And we want graduates who go from this place that we call the University of Global Health Equity to other places where they bring about change for the better, change for the good, working with others, being able to analyze, being able to understand, being able to interpret, but always being able to see a different way.